Thank you. Next tonight, teenagers in Sheffield say they want to see an urgent reduction in the time they have to wait to see a mental health specialist. Rising numbers of young people are reporting they're struggling with poor mental health. That's according to official figures. 1 in 5 young people report that they have a mental health problem, according to the NHS. This is an increase since 2017, when 1 in 9 8 to 25-year-olds said they experience mental health issues. In our region, young people are waiting more than 2 years for counselling or talking therapy, with Sheffield Children's Hospital's NHS Trust reporting their expected wait for a first appointment is now 2.5 years. Our reporter Hannah Gray has been talking to teenagers at Sheffield Future's Support Hub.
Not many people open up. That's why a lot of people in our generation struggle with anxiety, depression, and others because they don't know how to speak up, because not many people do.
Bravely sharing their experiences with mental health struggles, this group of teenagers love meeting up at a wellbeing cafe in Sheffield.
I was going through a lot of things, whether it was anxiety or, I felt like life was just crashing down on me, in terms of what I was going through at the time.
I was by myself all the time, had depression, anxiety, everything was just going wrong.
Coming here has really benefited and opened a lot of doors for me, so yeah.
People go through the same stuff as you and you kind of bond in a way.
In 2017, NHS figures suggested that 1 in 9 young people said they had a mental health problem. Now it's around 1 in 5.
The new government will have found a crisis in their inbox around children's mental health and well-being. There is a huge mismatch between the level of need and the ability of the services that we have to respond. We know that waiting lists are huge, with some children waiting years to get help and some children getting more and more unwell during that period.
Young people here told me they want to see the government prioritising wait lists immediately, as teenagers are feeling helpless and turning to things that cause more severe harm as they wait.
I particularly struggled because in 2020 my mum passed away, but I never spoke to anyone for sort of year and a half, 2 years.
There's people out there, the government may say to them, you got to wait 9 months, 10 months, whatever, but you don't know what that person can be thrown at them in that 9-10 months.
In the spring, Rishi Sunak's government announced more funding for mental health hubs. These give 11 to 25-year-olds the opportunity to get involved with local projects like Grow.
When you're outside in the sun, trees, birds, breeze makes you feel good. There's just all those indirect benefits of physical and mental health. And when you're working outside shoulder to shoulder with people, often that lowers anxiety and allows people to connect in a more holistic and less pressured way.
But the government funding only lasts for a few months, so there's a huge number of youth services calling on the new Labour government to take urgent action. The Department of Health told us they're committed to making sure every young person gets the help they need, and their aim is to recruit an additional 8,500 mental health workers to cut waits for treatment. Hannah Gray, BBC Look North, Sheffield.
Well, we heard there how long waits can be for some children. Earlier I spoke to Dr. Angharad Rudkin, who's a child clinical psychologist. I began by asking what someone can do if they are struggling but can't access support.
It is difficult when you're feeling desperate and you're feeling sad and you're feeling anxious and you're waiting for some help. I do get that. But there are lots of things that you as the young person, but also parents, can do to help things not get worse.